Okay, here's the deal. Med-Surg is hard. I know you're stressed right now thinking about it and going through it. So today I am giving you 3 steps to studying Med-Surg that will help you cut your study time down and not go out of your mind as much. Let's do this. Hello my friend, Christina here with NursingSchoolOfSuccess.com, and here on the Nursing School Show, I help you get better grades in nursing school and become the amazing nurse that you were meant to be. And today, girl, we are talking about Med-Surg nursing and specifically how to study in Med-Surg. So I've actually got 3 steps to walk you through how to study Med-Surg in nursing school. And it's actually super nice to have a plan, right? That way you know what to do next and it's not as stressful. So that's what we're gonna fix today. So step number 1 is to learn the pathophysiology. Bam! Learning the pathophysiology for each disorder should be your number 1 priority. Girlfriend, this is the foundation that everything else you need to learn is built off of. So you need this foundation of knowing the pathophysiology first before you can learn and go and learn everything else that you need to learn. So the pathophysiology of a disorder is just what is happening inside of the body that is just not normal. So you'll need to learn the process that's happening inside the body as the disorder takes place. And if you need help with pathophysiology in nursing school, make sure to check out the other videos that we have for you here on the Nursing School Show to help you out with that pathophysiology. And just a side note, if you are a Nursing SOS member, you have access to a ton of other pathophysiology and Med-Surg videos that are just not here on this channel. So if you are a Nursing SOS member, head on over to your member dashboard, click on the Med-Surg button, and you will be able to search by disorder and then find those videos there. All right, so that is step number 1. Learn the pathophysiology of each disorder first. Now, step number 2 is to review the other main components of that disorder that you need to learn about. And I always tell students that there are 4 primary things that you need to know about for each disorder along with that pathophysiology. Remember, that's your foundation. So these 4 things are the signs and symptoms, what you need to assess for, the nursing interventions that you might do, and what patient education needs to happen. If you look at your nursing school exams, those are the 4 main things that you are tested on: the signs and symptoms of the disorder, the assessment for that disorder, the nursing interventions that need to happen for that disorder, and then finally, what patient education that you should do. You're not often tested on the actual pathophysiology of the disorder. You're mostly tested on those 4 things. But like we said in step number 1, learning the pathophysiology is crucial to understanding the other 4 components. So that's why you need to do that first. And then here in step number 2, you will focus on those other 4 things. So you'll want to collect all of your notes around those 4 categories and get ready for step number 3, which is to put in the work and study efficiently. The key is efficiently, and I don't want you wasting time. I want you to study effectively. Stay focused while you study and spend a shorter number of hours fully engaged and learning Med-Surg rather than just passively studying, stressing out, and not staying focused. It'll take you longer. So make sure that when you sit down to study, you are refreshed, you're rested, you've got your coffee with you and your water, and you are ready to go. So here is what you're gonna do. These are the main ways that I recommend that you study. If you're a visual learner, write or draw out all of the concepts. I like to write and rewrite my notes over and over again. It's kind of crazy. I also like to create concept maps and diagrams. I am more of a visual and an auditory learner, so those 2 things really help me out to learn. And if you need a review on how to create concept maps, make sure that you check out the awesome video we have on that. It will actually walk you through step by step exactly how to create concept maps. Plus, this is super cool, I add some really great questions in there to help you critically think. So either way, make sure that you check that video out. Now, if you are an auditory learner like me as well, I recommend that you talk concepts out to yourself so that you can hear it. That really helps me. You can also create songs to help you remember it, or go through some mnemonics to help you remember it. All of those things are really good study tips for auditory learners. And if you are more of a doer and a kinesthetic learner, I definitely recommend that you get your booty into the skills lab and go through some patient situation. Grab your nursing bestie and run through some case scenarios together. Ask each other questions that will get you thinking more critically about the disorder that you're learning about. This hands-on experience will really help it all come together and sink in your mind. And if you need a list of questions to help you critically think, like I said, you'll definitely want to check out that concept map video that I mentioned earlier, which will walk you through that. I put a link in the description below, so definitely check that out. So friend, I hope that those steps help you totally rock med surg in nursing school classes. Step number 1 is to learn the pathophysiology of the disorder. This is your foundation for everything else that you will learn. Now, step number 2 is to review the other 4 main components of the disorder: the signs and symptoms, what you need to assess for, the nursing interventions that you might do for those disorders, and what patient education needs to happen. And finally, step number 3 is to actually get to work and do a deep dive into studying those 4 main concepts for each of those disorders. And that is your step-by-step guide for studying med surg in nursing school. Now, of course, if you liked this video, let me know. Hit that like button, share it with your friends who might also need some help with med surg in nursing school. I know my hand was raised with that when I was in nursing school. And definitely don't forget to subscribe and hit that bell to get notified each time we post a new video here on the Nursing School Show. Thank you so much for watching, friend. Now go become the nurse that God created only you to be. And I will see you right back here next time on the Nursing School Show. Take care.